Hello, and welcome to another episode of ED Talks. Today we're going to talk about surgical delays or surgical cancellations. So, what is a surgical delay slash cancellation? Well, that is when the anesthesiologist tells the patient and the surgeon that for various reasons, usually medical, the patient cannot have surgery on that day. Um, Obviously, this is stressful for all parties involved. Obviously, the anesthesiologist doesn't want to delay the surgery. Usually, the patient wants to have surgery, and of course, the surgeon wants to do surgery because that's how they get paid. Um, Usually, on the East Coast at least, there is quite a deal, there is quite a commotion when this occurs. Usually the surgeon gets upset, starts yelling and screaming about why and and that the patient can have surgery and that everything is going to be fine. Also, oftentimes many patients get very upset, even though the reason we are delaying their surgery is for their safety. They still get upset because they want to have surgery. They're emotionally invested in the surgery. They've prepared and had taken time off from their jobs for surgery. And so they tend to get very upset as well. And so those of us in anesthesia are faced with quite a bit of vitriol in our direction coming at us. And sometimes it's difficult to deal with, and sometimes it's difficult to diffuse the situation. So, what I hope that everyone understands is that when we do delay or cancel a case, at the end of the day, we are doing it for the safety of the patient. Oftentimes, surgeons know a lot about the anatomical issues with patients, but they don't understand so well the physiological issues that are going on within a patient. Um, and the best person to make that determination is usually the anesthesiologist. Granted, sometimes an anesthesiologist may cancel a case unnecessarily. This may be an inexperienced anesthesiologist or someone who doesn't or hasn't quite seen some of the medical problems that they're particularly being faced with at that moment. But in general, when we do delay or cancel a case, it is in the best interest and for the safety of the patient. And we hope, and I hope, that people appreciate that fact, um, and will allow us to move forward in making sure that everything turns out okay.